main things that we do is assess claimants. This process means that claimants are sent questionnaires in advance of their assessment. They come along to their assessment and I will go through all the information that they've provided. It's also the main opportunity to do a detailed physical examination of the claimant, and I will tend to focus on those areas where the claimant experiences pain and do a detailed examination. The next step is a review of the medical records, and depending if it's an accident or an incident or a medical procedure that is the index event, we'll look at the sort of the pre-accident or the pre-procedure medical records and the post-index accident or index procedure medical records, and make a detailed summary of those so we know how the claimant was before the accident or procedure and after the accident or procedure. The next important step is to pull all that information together and provide a robust opinion. And essentially what we're trying to say is what is wrong with the patient, claimant, what they're diagnosed with, and then give some indication as to their prognosis, whether they need any further treatment, what the likelihood of further treatment might be. We're also often asked by solicitors to answer a number of questions. Amongst those, one of the most important ones is patients' ability to work. For example, if they're not in the workplace, are they able to return to the workplace? And if so, in what capacity? We also get asked to do updated reports and addendum reports on claimants. This may be several months after the original medico-legal report has been done and further information has come to light, for example, further medical records or further medical reports. Increasingly now we're asked to view surveillance footage and provide a report on the contents of the surveillance footage, and then we have to look at that and then match that up with our reports and updated and addendum reports and comment on what we find in the surveillance footage. Another part of the job is meeting with the legal teams of the claimants. Often there can be case conferences where the solicitor is present, counsel is present, the claimant may be there and other medical experts, and there may be a round the table discussion about the evidence that all the experts have given. The claimant is there to provide extra information where required, and the expert witnesses are questioned further on their evidence. This particularly takes place if it is a possibility that the case may go to trial, in which case the legal team want to test the robustness of the evidence they have on the claimant. Occasionally it's necessary to go to court. In general, I would say that the legal teams are extremely keen to settle the cases as quickly as possible, to make settlement, finalise it and end the case.